Vision is a way that the associates can give back to the community and back to the other associates.
By giving to the Vision campaign, you really are helping four distinct groups of people. Yourself, when it's time for your need for healthcare services, your family members and those that you care the most about, your coworkers who will also need those services at some point in time, and the community at large.
As an associate, not only do the Vision donations allow us to provide better care for patients, but giving to Vision helps you know that the care or assistance is available for you whenever you may need it.
I'm a prime example of the success of what St. is able to do in this community relating to heart. I was on the job, I was prepared to start a procedure, and then all at once I felt like somebody just reached in and grabbed my heart. I've never experienced anything like that, so my mind is just racing and I'm feeling some tingling down one of my arms. I walked up to the doctor I was working with and I said, "Dr. Corey," I said, "you know, I'm not feeling very well. I think I'm having some chest pain." They got me to a stretcher, hooked me up to EKG, and I was having what they call an interior MI, or my left anterior descending wasn't functioning properly. The cath lab staff went into action and they did a wonderful job in every aspect to actually fix me, really. I mean, I really feel like God had me in the right spot at the right moment and the right people around me and saved my life. I didn't expect myself to be a recipient, you know, from Vision, and I just kind of just gave because, you know, I thought, well, it's the right thing to do, but now it's got a more special meaning to me now.
We talk about the Heart Vascular Institute and the physician's goals of reducing heart-related deaths by 25% in 10 years. You're talking about your family, your neighbors, your friends. You know, that's important. It's not this monolith out there that is taking care of people you don't know. If you don't believe that you make a difference, look at the cancer center, look at the hospice unit, look at the breast center, look at the mobile vans. You are making a difference.
Giving to the Vision campaign helps you to have the peace of mind to know that you've done everything you can to ensure that your family will have the best possible care should they need it at St. Elizabeth.
We had my 24-year-old son came in through the emergency room in full cardiac arrest. We were up in the ICU for 3 weeks before we had to make the decision to withdraw care. Words can't express what I feel for my coworkers here. This is home. This is my home. This is my family. Giving to Vision helps everyone. It's a way to carry on a legacy like my son. A donation was given to Vision in his name for the Heart Vascular Center. Hopefully someone else will not have to go through what we went through because they'll have the help that's needed in our own community.
Our coworkers are like our family. Giving to the Vision campaign provides us an opportunity to give back to the people that we work with every day, either through medical assistance or in time of crisis.
Neva meant the world to St. Elizabeth and to me and to everyone she encountered.
She was diagnosed in 2011 with ovarian cancer, went through chemo and still continued to work full-time on the floor. And she was able to use that as a conversation starter with the patients that it pertained to, and definitely an inspiration to them as far as going through the chemo the entire time she was working.
So as Neva went through her journey and had surgery towards the end and found out that there was nothing more that they could really do, we got to reciprocate the care that she had given to so many patients.
About 2 months before Neva died, she was a patient in the hospice center, and she did not want it to be a sad or depressing place, so she arranged to sort of have her own wake, and it was a real positive night, and it was funny, and she was cracking jokes.
Neva was an important part of the Vision campaign for many, many years. So people that ended up donating to that campaign ended up actually helping Neva
since she utilized those hospice services, both inpatient and the hospice home care.
Neva's spirit, I think, lives on every day. For the people that work here and worked with her, she was an inspiration. I think everybody who came in contact with her wants to be just as good as she was and kind of follow her legacy here at St. E's.
The Crisis Fund is really something special and unique about St. Elizabeth. There aren't many places in which employees donate resources to help their fellow associates when they have bad things happen to them, which they do. People's homes catch fire, tornadoes come through, and these are the funds that the associates themselves have given to their fellow colleagues to help them in those tough times. That's an admirable thing for this organization and the associates to do.
We've had a number of associates impacted directly from the Vision campaign through the Crisis Fund. We had an associate whose home burned to the ground while she was away, and her whole family was without anything. All of their possessions had been burned in the fire, and the Crisis Fund really helped put them back on their feet.
Most of us got into healthcare to give back to our community, and donating to Vision provides one more way to ensure St. Elizabeth can provide the best care possible to your friends and neighbors.
Because of the generosity of those that give to the Vision campaign and other donors, we're able to purchase the van and provide these life-saving screenings. We do preventative testing. I believe last year we performed almost 4,000 screenings, which involved about 1,400 patients. So to me, Vision means the opportunity that I have to give back to the community.
The community, they're the luckiest of all because their community is enhanced by your donations to the hospital. It's not just the healthcare professionals that benefit, it's the entire community, the other industries within the community, and basically everybody that lives here.
Vision is often a catalyst for projects that the foundation is trying to accomplish. Vision was the catalyst for the Heart and Vascular Institute. It provided the first $1 million, and there have been many, many millions of dollars that have been raised after that, but it's dependent on that seed. And Vision is the seed that ultimately helps the plant to grow.
The contribution to the Vision campaign means a tremendous amount because when our foundation members go out to the community and try to raise additional funds, and they can say that our associates feel so good and it means so much to our associates that they actually donate back to their employer, it really makes a difference.
Having a strong hospital is so important for the region. It's important for my employees. It's important for myself personally. It's important for my family. And we want the hospital to be the best it could possibly be.
I think that with the Vision campaign, if you have associates that are willing to give to their own institution, they have ownership in that institution and that facility.
I think St. Elizabeth embodies that spirit of Northern Kentucky. We want to have that kind of culture. We want to make sure that our associates are well taken care of. So I think collectively we continue to move forward with that type of care and service that makes us a hallmark, frankly, not only of Northern Kentucky, but in my opinion, one of the best places in the entire country.
Thank you for your giving. I find your support to be inspiring. It makes a real impact in the community.
You come to work every day and you give from the heart. You not only give your time and your talent, but with the Vision campaign, you give your treasure. But it's you and all the associates here at St. Elizabeth Healthcare that make this happen on a daily basis, and for that, I'm sincerely thankful.
I cannot express enough thanks and gratitude for the donations that our associates give. Whatever you can contribute, it makes a big difference and allows us to remain the best healthcare system in Greater Cincinnati.
I want to thank you for giving to the Vision campaign, the Heart and Vascular Institute, because it truly saved my life.
Vision means more help for our associates.
More care to the community.
There's more support for coworkers in need.
There's more communities reached.
More of the best.
More resources devoted to the hospital.
More of what can be.
More celebrations.
More time with your loved ones.
Vision means more opportunity to do better things for people.
One more.
One more.
One more.
One more.